Today, we're getting under the hood of midlife gut health with Dr. Z. Colette Edwards, a gastroenterologist and the founder and chief medical officer of Positive Health. How does menopause impact the gut microbiome, and what changes should women be aware of?
The first thing that I would say is that during the hormonal transition, the overall impact is typically most directly related to a drop in estrogen levels. There are estrogen receptors throughout the body, and that's why you can see changes virtually anywhere, and that's why you have a variety of symptoms. And so the lowered estrogen level impacts receptors in the gut, and after that, you can see lots of different changes. So you may see a decrease in the different types of organisms in your gut. You may see a change in the percentage of each of the different organisms. It can impact how your gut moves, and so it may move more slowly. It can increase the sensitivity that you may have to certain foods, and then it can also impact your metabolism. And then that can, in turn, have an impact to things like weight gain and cholesterol levels.
Is there a connection between estrogen levels and gut health? And how does hormonal decline affect digestion or inflammation?
So I would say that in addition to the changes that I had noted before, additionally, you may see changes in how your gallbladder works. It may empty more slowly, which can increase the risk of things like gallstones. It can change other hormones like cortisol, which is the stress hormone. It can impact hormones related to your appetite, which then ties into the weight gain. And then it can also impact how water is reabsorbed. And the amount of water that gets reabsorbed in your gut can then impact, are you having diarrhea? Are you having constipation? Are you going back and forth? So I would say that in addition to the changes that I had noted before, additionally, you may see changes in how your gallbladder works.
What are common gut-related symptoms women may experience during menopause, and how can they tell if it's hormone-related?
So, a lot of the different symptoms that they may experience are common ones that happen in everyday life, which can then make it sometimes more difficult to determine, is this related to things that are happening to my gut, not related to the hormonal changes of the menopause journey, or are they related? So, some typical symptoms would be gas, bloating, constipation. You may see a change in bowel habits. I had mentioned that there's an increased risk of gallstones. A small percentage of people may experience some nausea. Small percentage of people may have some abdominal or pelvic pain, and people who have never had a problem with heartburn, or at least heartburn that they have felt, called reflux, may begin to experience. And I had mentioned the impact on hormones related to your appetite, and the drop in estrogen can change the levels of those hormones. So you may, typically people will see an increase in their appetite, or they will start having food cravings similar to what some people may experience during pregnancy. And in terms of how do you tell the difference between the two, it really involves looking at the whole person. As is so often the case during menopause, a lot of the symptoms, other than kind of the stereotypical ones of hot flashes and night sweats, are often symptoms that many people have on and off during the course of their lives, including men. Typically, in terms of testing for hormone levels during the period of time that a person may be making the transition, the recommendation is not to do the testing because of the definition of what menopause is, which is 12 consecutive months without having a period. Now, that gets a little bit more complicated, obviously, if you have had a hysterectomy, for example. The other reason is because during the transition, hormone levels are bouncing all over the place. So one day you may have them completely off the wall. The next day or later in the day, they may be completely normal. And so it's really important to have you, as the person experiencing the symptoms, really paying attention to the symptoms that you're having. Are these things that you have had in the past? Are they more prominent? Are they causing a big change in your ability to get during the day? Do you have other symptoms like hot flashes that would be a potential clue that this may be hormone related? So I guess what I'm saying is it is really looking at the context of a bigger picture of what is happening with a person and other symptoms that may be commonly seen in menopause in addition to the GI symptoms. I would say there are certain symptoms, particularly things like a change in bowel habits, that it's important not to then start attributing everything that is changing in your body to menopause. Change in bowel habits is kind of a red alert that things need to be investigated to make sure that you don't have a problem with colon cancer or an inflammatory process. But it really is a matter, as I think it should be always, to really look at the whole person and what their any underlying chronic conditions they have, what their medical history is, what their family history is, and then if it really remains opaque, then to consider getting some testing done. The other thing that I will say is that several of the GI symptoms that people may experience during the course of their life or experience during menopause could also be symptoms related to thyroid conditions. And thyroid conditions are more common in women. And if a person has underlying thyroid disease, then their symptoms may become worse. Or it may be that some of the symptoms are actually related to a new thyroid condition. So that's why it's really important for you as the patient to be clued in, because no one's ever going to be in your body, and to really make sure when you're having the conversation with your clinician to talk about what it is you're experiencing. And I would say you yourself, make sure you bring up the question of, could this possibly be related to menopause? Because it's not necessarily something that your clinician is reflexively going to think about. And if no one is thinking about it, then typically no one is going to do anything about it if it is related to menopause.
Can gut health influence the severity of menopause symptoms like hot flashes, mood swings, or fatigue?
Absolutely. And it is related to the reality that there are estrogen receptors throughout the body, and therefore it can definitely impact symptoms like hot flashes. It can impact symptoms like your mood. It can impact, as we talked about before, hormones related to your appetite and your metabolism. It can impact how your gut is absorbing water and nutrients. And for some people who may have an underlying inflammatory GI condition, it can also impact the degree of inflammation that they are experiencing. Absolutely. And it is related to the reality that there are estrogen receptors throughout the body, and therefore it can definitely impact symptoms. I want to bring up at this time what people think of as people will refer to the gut as the second brain sometimes because of the connection between the microbiome and the brain. And that is when you start seeing the relationship and the impact as relates to things like mood. And that is why it's so important throughout your life, but particularly during the menopause journey when you then have this extra hormonal change happening, to do your best in terms of what you are eating, healthy eating, exercise, and sleep, because those things can impact the microbiome, which then in turn is kind of a cascade or a domino effect to other things. And so if you're doing great things for your gut, then you, in essence, are doing great things for the rest of your body. And it goes the other way as well.
How important is diet in managing gut and hormonal health during this life stage? And are there foods you recommend increasing or avoiding?
So, extremely important because of the impact on your gut microbiome. And just to give you another example that is not related per se to hormones, but for example, there are certain bacteria that have been identified and seem to be tied to something like colon cancer. And that type of bacteria may be seen more frequently or in greater numbers in certain populations, which then increases the risk of colon cancer in that person or in that population. And so I want to make a really extreme example, if you will, of the importance of maintaining a healthy gut microbiome. And so there are foods that increase the likelihood that you will have good bacteria, and that will increase the likelihood you have a variety of different organisms and will increase the likelihood that the different percentages are in balance. So things like some of the common ones that people think of would be, for example, in the probiotic front, would be sauerkraut or kimchi, yogurt, kefir, kombucha. But then there are others like asparagus, onions, leeks, certain fruit like apples, bananas, and then in terms of certain grains and high fiber foods. And high fiber foods are additionally important because they will make it more likely that you feel full. And so you'll have less of a tendency to overeat, which then positively impacts any changes in weight. And then it also keeps things moving through your gut, which is very helpful in terms of the risk of things like colon cancer.
What role do probiotics and prebiotics play in supporting menopausal gut health?
So prebiotics increase the number and diversity of the type of good bacteria that you have that supports gut health. Probiotics are actually good organisms that you are adding to your microbiome. And so, for example, you may, after or while taking certain antibiotics, your doctor may say to you to, depending upon the antibiotic, to take a probiotic or to ingest foods like a yogurt because the antibiotic will wipe out certain bacteria that then throws everything off, and you want to get things back in balance. I think it's important for people to also remember that there are certain foods that can be detrimental, both in terms of their impact on the microbiome, in terms of the types, the diversity, the percentages, as well as setting up an inflammatory process in your entire body, including your gut. And if you are eating, if your diet is predominantly foods that aren't good for you, that's going to have an impact on your gut microbiome that will be very, very difficult for prebiotics or probiotics to overcome. So, a big one would be processed foods, ultra processed foods. Sugar is another big one. Alcohol is another one that can have an impact on your gut microbiome, and then it has other implications as well, including that it can be a trigger for hot flashes. So it's important to think about the foods that are going to be good for your microbiome. And I will say that foods that are good for your gut microbiome are foods that tend to be good for the rest of your body. And an example would be kind of following the Mediterranean diet, which year after year after year comes up as kind of number one. And when different dietary patterns are compared and rated every year, if you stick to something like the Mediterranean diet, for most people, you will be on a really good track.
Is there a link between gut health and mental wellness during menopause, such as anxiety or brain fog?
Absolutely. And I guess one of the things that I will flag for people is that during the hormonal transition, once again, the fluctuating estrogen and progesterone levels, and then the ultimate fall to a much lower level definitely impacts your psyche, and it also can produce brain changes. And so you can be a person who has never been someone with anxiety before or depression before, and you may find yourself with one or both. You could be someone who has had one or the other, and it's been under good control. The hormonal changes can trigger an episode, or if you're in the middle of an episode, it can make it more difficult to manage. And that is something that is really important to be clued into. And I'll give you an example. So you are a person who has depression and it has been under good control. All of a sudden, you find it's not under such good control. And so you can see how it would be if no one is thinking about menopause and hormones as a possibility. You go into the doctor and say, my medication doesn't seem to be working as well. So the medication gets increased. That doesn't do it. So then you're on to the next medication. and that doesn't do it. And so you can see how you can get into this cycle because no one is thinking about what else could be impacting it at this point in time. And so it may be that you still need your antidepressant, but you also need some help from hormone therapy if you're someone who can tolerate it and there aren't any reasons for you not to use it. And so that's why, once again, look at the big picture, think of all the possibilities. And so those two conditions, as well as people who have bipolar disorder, they may find that things are more difficult to manage. If your gut microbiome is not in good shape, then that can contribute to inflammation, which can impact your brain and how well it is working. And so the hormonal changes can contribute. A big complaint that people have is brain fog. I will say that for most people who experience it, within 2 years, things will go back to normal for most people. When you're going through it, it can be very frightening, obviously. But that is another way that your gut microbiome can potentially cause some menopausal symptoms. I had talked about the impact that the menopause journey can have on other hormones. And so, if other hormones in your body are off kilter, then that can in turn impact your mental and emotional health. And during the hormonal transition, a lot of people experience stress or even more stress than they have already been managing. And stress is not helpful. Chronic stress is not helpful to anything or any part of your body, including your brain, including your hormone levels. And so, another thing that's really important during this time is if you have not found something that really clicks for you to help you cope with stress in your day to day life, then this is the time to really find out what you like, what combination of things you like. And so, it could be meditation, it could be physical activity, it could be a gratitude practice. Now, the list goes on and on. And each person has to find a thing that really works for them. But it's important to spend time finding that. And really, this is a time that I think that the return on investment, if you will, and the payback you will get to really start focusing on you. And women tend to be people who are more focused on others, and they're the last person they think about. This is the time to really get that turbocharge of focusing on you because it can have such a big impact. Your symptoms, but in addition to that, your risk of both physical and mental health conditions, and therefore impact your future life, the many years ahead, your quality of life, etc.
How does menopause affect metabolism and weight gain? And what part does gut health play in this?
So the microbiome in your gut, as we have discussed, has the estrogen receptors. And when things are off there, it can impact other hormones. And so your body has two hormones. One is leptin and the other is ghrelin. And their role is to keep you on the straight and narrow in terms of your appetite and feeling like you're full when you've eaten enough. And so leptin helps leptin helps um, tell you that you've had enough and keep your appetite and the cravings under control. And then ghrelin will tell you you need to be eating something. So if you get an imbalance in that, you can see how you could end up with a combination of I have a craving, my appetite is greater, I eat more, the other hormone is not kicking in to tell me, okay, you need to stop. You are actually full and you're eating past your point of fullness. And therefore, you can then see how the weight starts to collect. I will say that when the studies have been done at a population level, that the number of pounds that have been attributed to menopause per se is only about 5, which I know scientifically that's what they have found. I have to say, and this doesn't sound scientific at all. It's just like I find that hard to believe, just given the number of pounds that lots of people tend to put on. But most of the pounds that people are putting on during the time that they may feel like they're going through menopause are actually related to the fact that their metabolism is slowing down simply because they are getting older. So that, once again, is another reason to eat healthy. That is another reason to have physical activity. That's another reason to focus more on strength training, because if you have gained 10 pounds, 15 pounds, 20 pounds, you can't just attribute it all to the menopause journey. And the sooner that you take that into account and recognize things have changed, They're going to continue to change, and it's going to be harder to get the same result than 15 years before, the faster you can get things under control. Um, and getting things under control, one part of that is to take care of your gut microbiome.
Are there specific tests or diagnostics you recommend for a woman to assess their gut health during or after menopause?
There are a variety of potential test procedures that might be appropriate. I wouldn't say due to the menopause transition specifically. It's more, once again, look at the entire person, look at the symptoms that they are having, look at their past GI history and their family history. And so, the typical age where a person reaches that point of having gone the 12 consecutive months without a period tends to be late 40s, early 50s. And then people need to even more so take into account the need to have colon cancer screening. And because there has been an increase in colon cancer rates, actually of the younger age group, that it is really important to take the screening seriously. And that is one of the reasons that the recommendation has been lowered from 50 to 45. And it could be even different depending upon your family history, for example, or whether or not you have something like Crohn's disease or ulcerative colitis. So I'll just throw that out there. The menopause transition is a time to really make sure that you are focusing on preventive care. And there are more things that you need to focus on because they're just conditions that are more likely to come into play as you get older. I had mentioned thyroid as a possibility. There is some controversy in the medical community, I will say, about does everybody need to have thyroid testing once they reach a certain point, particularly women, because it's more common in women. I think, once again, talk to your clinician, look at the big picture, and see if it makes sense. And if it is, for example, a scenario where you're having a change in your bowel habits and it's a persistent thing, not a 1 day thing or a 2 day thing, then in addition to thinking about, okay, is this colon cancer or something or a flare of an underlying GI condition, is thyroid disease a possibility? And I will say that, typically I had mentioned that general screening for hormone levels for menopause is not recommended. But let's say, for example, you are developing symptoms at a much earlier age than anticipated, then that would be a good time to have your hormone levels tested. But it would also be a time to think about thyroid function, even at a younger age, because some of the symptoms can be the same. And so you really want to be looking at what are the potential possibilities or a combination of possibilities that could come into play. So it's really in my mind, separate from the cancer screening testing. It is really, who is the person sitting in front of the clinician? Who are they? What is their history? What are their symptoms? What has changed? And I know that I'm like a broken record saying to people, you really need to be clued into your own body because you're the one who's in your body 24/7, 365. No one is ever going to know what it feels like to be in your body or what you're truly thinking. And so it's incumbent upon you to be processing that. You're the CEO of your body, mind, spirit. And so you need to take control of your health and well-being because no one can really do it for you. They can support you, they can get you to the things that you need to get done, they can encourage you, but ultimately, the buck stops with you. There are a variety of potential test procedures that might be appropriate. I wouldn't say due to the menopause transition specifically. It's more, once again, look at the entire person, look at the symptoms that they are having, look at their past GI history and their family history. And so, the typical age where a person reaches that point of having gone the 12 consecutive months without a period tends to be late 40s, early 50s. And then people need to even more so take into account the need to have colon cancer screening. And because there has been an increase in colon cancer rates, actually of the younger age group.
What are the top 5 tips for a healthy gut in midlife?
So I would say there's a theme that arises when you look at the vast number of conditions, syndromes, etc., that a high percentage of people may experience over the course of their lives. There's certain basic foundational things that will stand you in good stead, regardless, from the standpoint of reducing your risk of having a problem, reducing the impact if you already have a condition, keeping you in the best state possible to optimize your quality of life and to be prepared for something that may hit. So, healthy eating, managing your stress, physical activity, particularly strength training during the menopausal years, taking care of your gut by doing these other things, staying sufficiently hydrated. I will flag that fatigue is a common symptom of people during the transition, and your hydration level is something that can be very subtle. You may think that you're getting in enough. You may think that you are hydrated and not realize that you actually are not. And that can show up as fatigue. That can show up as you're feeling hungry when really what's going on is you're feeling thirsty. Finding ways to cope with stress, like we had talked about before, because chronic stress can be devastating to your entire body. And I think the other thing is just in general, as much of the time as possible to have a positive outlook. I don't see positive outlook means that nothing bad is ever going to happen to me, but it will stand you in good stead in terms of facing the challenges. And even with a positive attitude, bad things happen. There's not really a downside to having had that positive attitude. Um, so, and then the other thing I would say is to just be true to yourself. This is a time of transformation. When you look at other countries, cultures, societies, they may have a very different attitude than you typically see in the US. It may be a time where people feel a greater sense of freedom. They may have greater status in their community. They may feel like they have accomplished a lot. And now it's time for them to take some time for them and to also think about what they want their life to look like for the rest of their lives. And so I would say don't suffer in silence. There are many options to address menopausal symptoms. Take care of your body and spirit and try to think of this as a positive and an opportunity to do the best that you can to increase the likelihood of having a fantastic life for the rest of your life. So I would say there's a theme that arises when you look at the vast number of conditions, syndromes, etc., that a high percentage of people may experience over the course of their lives. There's certain basic foundational things that will stand you in good stead, regardless, from the standpoint of reducing your risk of having a problem, reducing the impact if you already have a condition, keeping you in the best state possible to optimize your quality of life and to be prepared for something that may hit.